Some of you have probably heard stuff like this. Not all infidelity means the relationship ends. In fact, you may grow from it. Or couples therapy can help couples heal. You just need to make time for each other and communicate. Or forgiveness can help any relationship grow stronger. Go ahead. Somehow I can see you. Raise your hands if you have ever heard this stuff, and raise your hand higher if you've heard this stuff from a person that you may have turned to for help, a therapist or a healthcare provider or even a pastoral counselor, maybe a coach. One of the big challenges that people who are trying to navigate a narcissistic relationship or to heal from one or do both is that the ways we do therapy don't typically always work for folks who are going through narcissistic relationships. Because in general, the way the mental health world works, we do tend to diagnose the person who comes into the therapy room. So when a person who's experiencing a narcissistic relationship shows up for therapy, and that person is sharing their anxiety or panic or sadness or apathy or hypervigilance, they often get diagnosed. And if the therapist doesn't fully understand the landscape of antagonism and what happens in these relationships, it may be a lot of, let's figure you out, instead of, let's support you and help you feel a sense of safety as you are made aware of the unhealthy patterns in this relationship. People often don't get education about the consistency and harm of the relationship patterns that they're up against, nor are they taught about how these patterns show up in relationships. So when I have talked to and trained therapists, especially therapists who do more couples-oriented work, and I push on this, I will get this answer from them. People will say to me, especially people who do couples work, will say, well, these kinds of relationships with people who have all this personality stuff and narcissism, that's the exception. Obviously, nothing can really be done. Well, that's a bit defeatist too, isn't it? Because there has to be something in between. There has to be something in between. Communication always works, and you just need to swoon with gratitude over the narcissistic person, and the other side of, well, just giving up and hearing, well, your life sucks and there's nothing we can do to help you. At a minimum, this is shaming and can leave many people in narcissistic relationships feeling even worse about their situation than when they came in. Listen, people in narcissistic relationships already feel like they're in something unusual and not understandable enough. But the sense of shame that, well, there isn't really anything we can do, or I don't know what to do to help you, or if you don't leave it's not going to get better, can multiply the shame that survivors already manage every day of these relationships. Listen, I've been having to take this fight a lot more recently. I don't know why. Narcissism is an oddly uncomfortable space and conversation in the world of therapy and psychology. And I think it's mostly because narcissism makes things messy. It removes some of the solutions. I mean, therapy is more difficult with narcissistic clients. Other psychiatric issues like addiction or depression may become, more of a treatment challenge when personality issues like antagonism or narcissism are afoot. When a couple comes into therapy and one of the members of the couple is narcissistic, it's challenging, and you have to have a very skilled therapist in that room. It often may not work out well. I mean, a lot of different things can go wrong. The client who is enduring the narcissistic abuse is often treated like the one who is the one with the problem. Things like, well, maybe because you're always so anxious, that puts your partner on edge, and that's why they're getting triggered, that kind of thing. Narcissistic clients may behave in a very entitled manner with therapists and are even more likely to be litigious with their therapists. And in fact, some therapists do screen narcissistic and antagonistic clients and say that the challenges raised by these clients might just be that they feel that they don't have the skill set or the expertise to work with them, or may not necessarily always want to take the risk. And as an interesting topper to all of this, narcissistic personality and the treatment of people with narcissistic personalities, the assessment of people with antagonistic or narcissistic personalities, none of this is really ever taught in graduate programs. So nobody's learning about this at the time they should be learning about this. The tricky issue with mental health is that there are no absolutes. We're never 100% sure of a diagnosis. There's rarely that one best treatment that works for most clients. There's no blood test. Everyone's history is different. Everyone's culture is different. Our experience walking down the street is different based on where we live, how we look, who we are, and everyone's biology is different. So when someone says there's a universal approach to managing something, in the world of mental health, that's already a little bit suspicious. But mental health in a capitalistic world is like any marketplace. And there are some things that people say that are sold as universal, that we have the best approach to depression. This is the best way to work with couples. This is the one way to heal from a broken relationship. That ain't true. So when a person in a narcissistic relationship comes into one of these so-called best approaches, the way to do the work, it rarely works. Because this issue of narcissistic relationships is often a place of exception in the world of mental health. Narcissistic relationships and what happens to people in these relationships often doesn't traditionally fit into the space even that we call domestic violence or intimate partner violence, because in many cases there's no physical violence. What happens to folks in these relationships may not fit into the traditional mold of what we call PTSD, because emotional abuse is often not coded as trauma. I personally think it is, but that's not always the prevailing wisdom on this. It doesn't even really obviously fit into addiction, even though that is what it feels like to trauma-bonded people who can't seem to get out of a situation that is harming them and feel compelled to stay in it. It's not obsessive-compulsive disorder, even though a person in a narcissistic relationship may feel that their rumination borders on obsession. People who go through these relationships do not fit into a tidy diagnostic box. Couples therapists believe relationships can be made to work better through communication. Many, many relationships can be made better through communication. Probably not these narcissistic ones. And a final interesting wrinkle with many folks who are experiencing narcissistic abuse is that folks who are in these relationships, you keep it together in a lot of places in your life. Many people going through narcissistic relationships are often showing up well as parents, in friendships, at work. And while inside your head there is a sense of confusion and self-doubt and rumination, this is another reason that folks in these relationships can get missed. The thought of, well, okay, I'm doing fine in my life. Yeah, but in that one, or if you have more than one narcissistic relationship, you're deeply confused. And you often walk around with a sense of self-devaluation and self-doubt that is both embedded into your identity, because you heard it so many times, but is also protective. For example, you put yourself down before the narcissistic person can put you down, or they feel threatened by you. But what does that mean for a person in a narcissistic relationship? It means that your case is sort of the exception, the car that the mechanic no longer has parts for, the patient with an illness that no medication has yet been developed for, the test case that has never been tested in court. I was recently sort of half listening to a lecture recently where one therapist was asking another therapist who had developed a very widely used form of therapy. The therapist asking the question was very clearly asking a question about a case of narcissistic abuse. The case she was describing had lots of manipulation, emotional abuse, very little accountability. There was no physical abuse. And the therapist with the therapy method kept sharing how her tool could work in any relationship situation. And each time she gave a technique, the lady with the question saying, I tried that. But then the lady who developed the therapy method just sort of threw up her hands and said, well, In those cases, with people with these personalities, this just doesn't work. And then the lady asking the question asked, reasonably so, well, what do you suggest? And the woman with the magical method said, I don't know. We don't work with these cases. How convenient. It's like having a bag of pistachios and only opening and eating the pistachios with that little space already in them and leaving all the sealed ones in the bag. It's like only folding the flat sheets and leaving the fitted sheets, you know, those ones with little, you can never fold them right, for someone else to fold. It's painting the middle of the wall and leaving the edges for someone else to deal with. Come on. There is a traditionalism that pervades the world of psychology and that can often miss the unique elements of these relationships. And it also sucks to have to see that sometimes we can't fully change a situation or even change it to a particularly healthy place. That sometimes forgiveness isn't healthy for us. Sometimes families do become estranged, and that estrangement may in fact be healthier for some of the people in it. Sometimes splitting up is healthier. Sometimes splitting up is dangerous. Sometimes the charming, charismatic, nice person is also a mean, manipulative, critical, undermining person. In many ways, narcissistic relationships defy what we believe we know about people and human behavior. And that is why people in these relationships doubt themselves and question themselves and feel like bad people and struggle and often find that they can't get the help they need. Listen, sometimes it is nice to be the exception when it's in the right direction. But in this case, being the exception sucks. And people can be shamed by systems of care for years, be told that they aren't communicating right, being asked to take more accountability, being scolded for using the word narcissistic, being questioned about whether they're asking for too much, being told to forgive, and simply not being validated and held with their experience and taught what narcissistic patterns are about. Yeah, this is a paradigm shift, but paradigm shifts are good. Healing from these relationships can't be done alone. A person needs support, but the supporters need to understand it. And sure, narcissistic relationships are the exception because as much as it feels like it's everywhere, it's really not. It's not that frequent. It's probably somewhere 1 in 10, 1 in 9. So it's not everyone. But when you're going through it, it's a unique pain. And to just be treated like you're the exception, so I don't know what we could do, can already add more invalidation to a situation that feels helpless enough. Thanks again.